Alright, this is my patient Eric, and I'm going to be doing a assessment on him on his lungs and his thorax and his heart. Have you had any changes or concerns in your breathing or your lungs that you know of? No. Alright. We're going to start out by assessing his chest. It does look symmetrical. Can you take a big deep breath for me? When he breathes in and out, everything rises and falls. His intercostal space, his costal margins, and costal angle all are symmetrical when he breathes in and out. His substernal notch is right through here. Then his sternum is through here, and then his xiphoid process is down here. This is his costal angle, and the sides of it are the margins. Intercostal spaces on both sides. Any pain? Take a big deep breath for me. His respiratory muscles look normal for his age and gender. They rise and fall at the same time. Alright, we're going to be looking at his trachea. Can you look up for me, up towards the ceiling? Feel his trachea. Swallow for me. His trachea is midline. There's no masses or lesions or lumps I can feel. Any pain?
Mm-mm.
Alright, let me see your fingers. Fingernails. His fingernails are smooth, are transparent, so no clubbing is present at this time. Can you stand up for me? And turn to the side for me. I'm going to measure his AP diameter. Alright, now turn facing towards the refrigerator. His AP diameter is about 50% of his transverse diameter, which is what you want. Sit down back for me. I'm going to listen to his lungs. Big deep breath. Respirations are even, they're not labored. He's breathing about 15 respirations per minute. His lungs sound normal. There's no crackles, wheezing, bronchi, or anything. Alright, I'm going to be listening to the back of his lungs. Alright, now I'm going to percuss his back. Resonance is heard throughout all the lung fields. It's really kind of hard to hear in the background here. And the diaphragmatic excursion measures to be about 4 centimeters bilaterally, which is normal. It's 3 to 5 isn't normal finding. Alright, we're going to look at the lung expansion in the back now. Sit up straight for me. Alright, and take a big deep breath for me. The folds in the middle move laterally symmetrically bilaterally. That means that everything is symmetric and is working like it needs to be. I'm going to have him say 99 for me while I hold my hand at the back of his, on his back to see if his tactile firmitis is equally bilateral. Can you say 99 for me?
99. 99.
Alright, the vibrations are equal bilaterally. That means that is good and intact. Alright, I'm going to finish my assessment. I'm going to be listening to Derek's heart. I'm going to listen to all of his heart sounds. Listen to his aortic. Pulmonic. Herb's point. Tricuspid. And then mitral. Then I'm going to listen to all of them with the other side of my stethoscope and listen for a murmur. Alright, his heart sounds good. There's no murmurs. Just S1 and S2, it sounds clear. I'm going to listen to his apical pulse of his heart. And you find it by finding the 5th midclavicular, or the 5th intercostal space. And then midclavicular line. You can listen for a full minute. Alright, S1 and S2 was heard. There was no murmurs. It was clear. It sounded like he was in a sinus rhythm. No thrills were palpated. No wide impulses. The PMI is strong and is located along the left sternal border. The aortic, when I did his heart rate, while he was sitting here, it was 76. The same with the pulmonic. Aortic was all 76. The tricuspid, mitral, and herb, they were all 76 as well, all regular. There was no murmurs, no thrills, and they all sounded good, all sounded the same. I'm going to have him lay down on the couch here, and I'll do him supine and on left lateral. Alright, while the patient was laying supine, I checked their heart rate, the apical pulse, for 1 minute, auscultated that for 1 full minute, and it was 70. It did go down a little bit, which is normal. I heard S1, S2, and he seemed to be still in sinus rhythm. And then when he was on his left lateral, I auscultated for a whole minute on his apical pulse. Still S1, S2, no murmurs, and seemed to still be in sinus rhythm. And that is the end of my heart, thorax, and lung assessment.